Hello and welcome to Health with Kylie and Kylie, the podcast where today we are delving into the intricacies of mental health. We are going to be looking at providing insights for support, breaking down some of the stigma surrounding mental health. I am Kylie Ham, your host, and I am here today with my co-host, Kylie Jade, and our very special guest, Brandi Cole, who is a mental health nurse practitioner. Hi, Brandi, and welcome to the podcast.
Hi, Kylie and Kylie. Thank you for having me.
Thank you so much for coming on. Let's just dive right into it. Can we just start with you introducing yourselves to our listeners, giving us a little bit of background, your qualifications, things like that?
Sure. Thanks for having me. I'm Brandi. I am Canadian for anyone listening. I grew up in Canada and studied psychiatric nursing was my first degree. I studied a Bachelor of Psychiatric Nursing right out of high school. So I very early on knew that I either wanted to be a psychiatrist or a doctor. That seemed too long to do in university, so decided to become a psych nurse. My specialty has always been older person's mental health or geriatric psychiatry. I then moved to Australia in 2005 and commenced a master's of mental health at the Institute of Psychiatry in Sydney, which was amazing. And then in 2016, I went on to do a master's of nurse practitioner. So I am a nurse practitioner with a specialty in mental health and aged care. Geriatric psychiatry is what I often tell people. I'm also a senior lecturer at the University of Newcastle, and I currently am the program convener for the Masters of Nurse Practitioner program. So I've got a few hats, but really passionate about mental health, older people and aging, passionate about older people in Australia getting the best care that they can receive, and passionate about educating nurse practitioners for the future who will hopefully also take care of older people and people with mental illness.
Wow. Definitely a lot of hats there.
Yeah. I'm also a mom and a fiance. Yeah. So I've got a few other hats, a friend, a daughter.
Yeah.
Yeah.
That's awesome. Thank you. Kylie Jade, would you like to start us off today with Brandi?
Yeah, sure. So I think to kick things off, we might just jump straight into understanding mental health and what, in general terms, what mental health means. Like, what is the definition of mental health and the difference between mental health and mental illness, if you don't mind.
Yeah, sure. So I guess just broadly, mental health is really a concept of how we are within ourselves, our well-being, our emotional state. And mental illness is sort of a broad umbrella term for a whole category of psychiatric diseases or conditions that impact somebody's emotional state or the way that they think and connect to reality. So in psychiatry, we have a diagnostic statistical manual of mental illnesses. It's known as the DSM. So that's sort of the Bible in psychiatry of what we use for diagnostic criteria for illnesses. And that gets updated about every 5 years by an international committee. And the illnesses come and go in that DSM Bible that we use. So things get put in and taken out all the time. But there's plenty of different illnesses that can cause people mental distress, and some of them, some conditions are chronic and very debilitating and can be lifelong. But just in terms of mental illness too, just to, I guess, take, if this is a good opportunity to just give some stats around it. So the World Health Organization in 2023 released they're always updating sort of the information that they're providing on the global scale of mental illness. And Depression is now one of the leading causes of disability worldwide, and suicide is the fourth leading cause of death amongst humans across the world, ages 15 to 29. Yeah, and it's so huge. And here in Australia, we also have a community that suffers greatly with mental illness. The rates of mental illness in Australia are rising all the time. Currently, 2 in 5 Australians will have suffered a mental illness at some time in their life. And we have about 5 million patients in hospitals each year for mental illness or psychiatric related illnesses. So it's the type of thing that really impacts everyone, whether it's on a um, anxiety, which is something that probably everybody experiences at some point in their life, and then more severe mood disorders like depression or bipolar, and then more serious illnesses like psychotic spectrum illnesses like schizophrenia, which can be lifelong and very debilitating for people. So certainly something that I think everyone should be aware of, and the more we talk about it and make it something that we all know affects everybody, we know that people are more likely to access help, and obviously reducing any stigma around that, because it's sort of a part of the human condition.
Those numbers are quite extreme.
Yes, yeah. They do a national study of mental health and well-being here in Australia, and the Australian Bureau of Statistics released that. So the one that they released in 2022 said that you had the 2 in 5 Australians ages 16 to 85 experienced a mental disorder. 1 in 5 people who had experienced a mental disorder in their lifetime had symptoms in the last 12 months. So 1 in 5 people right now are mentally ill. In Australia, there's a higher proportion of females than males that experience mental disorders, and usually with higher rates of anxiety and depression. And yeah, the people ages 16 to 24 were most likely to have had a mental disorder in the last 12 months versus older people who were actually less likely. So we certainly know that our younger generations, for probably a whole plethora of issues, are seeming to experience higher rates of mental illness than we've seen in past generations. So it really affecting our children, our grandparents, our parents, our colleagues, our friends, our partners.
Yeah.
So yeah, important topic to be aware of.
Absolutely.
Yeah, absolutely. Yeah, thanks, Brandi. Those statistics are just absolutely mind-blowing. So the question I have for you, and this is not in our notes, but how would someone know if they have a mental illness or a mental disorder? And also, like, how would they know? Like, how do they know if, like, their child or someone they know might be experiencing an issue with mental health?
Yeah.
Like, what are some of the common signs? Yeah, and symptoms.
So I guess a big thing is just noticing a change from someone's normal self, and usually when it starts to become when it impacts their life on a broader scale. So a good example is anxiety. So if we use that just generally, everybody probably experiences a bit of anxiety, whether it's about meeting somebody new or speaking in front of a crowd or driving in a lot of traffic. Some people get anxiety driving down to Sydney because that highway is crazy. So it's when that anxiety starts to impact their broader life. So it's not then going out with friends because you're too anxious about the crowd or the drive there, or missing work because that anxiety makes you feel so uncomfortable that you just can't go. So when it starts to impact relationships, your connections, your occupation, your ability to even your education, your studies, if it's then causing so much stress around studying that you're not going to school or attending class, or it leads into unhealthy habits. So somebody who's got anxiety, who maybe is drinking alcohol to try to calm their nerves, when they need that self medication more frequently, and then that becomes a problem. So it's really when these conditions start to impact your functioning on a global level. So same with depression, we all get the blues. Like life can be tough. It's not easy, and you can lose a loved one, for example, or find out that something tragic happened, and you can feel, a sense of sadness and grief around that, which is absolutely normal. That's normal human response. It's when that then starts to impact other parts of your life. So when that sadness extends for such a period that you're losing friendships, you've lost your job because you're not able to attend or concentrate. That's when we know that mental condition, that mental health has now become mental illness. So I guess for anybody, like one of the things that I really try to impart on people is that we're all humans living in this world, and we can have ebbs and flows. But if you notice in your child that they're acting different, so maybe they're withdrawing, they're spending more time in their room, all of a sudden they're not hanging out with their friends, or their grades start to drop, you would then be questioning what's going on, what's the trigger here, what's happened. And same with friends. There's a lot of normal parts of life that can be really hard on people, like moving, divorce, separation. Some people find it really hard when their kids graduate high school and then they leave the house. That's another huge transition. So our lives come with these seasons and changes and chapters, and some people cope with those changes better than others. So it's just, how are you coping with that? And if it gets to a point where you identify that you're not coping, or a friend isn't coping, that's when people really should get help. And I always say, like, go to your doctor anyway and have a chat. Psychologists are amazing. Counselors are wonderful. Like, having somebody to speak to who's a professional, who might say, you know what, this is just normal right now. Try these different strategies. And if in a few months things still aren't good, then maybe we'll look at something else. So there's lots of non-pharmacological approaches to helping people cope with normal mental changes, but there's also a time and a place where medication is very appropriate, if not needed, in some people and in some mental illnesses.
That
Did that
sparks
answer your
a bit of
question?
a off-script question for me, if I can jump in. So what would be your few, like, I don't know, let's go 3 to 5 tips in, I don't even know how to word it properly, in looking after your mental health so it doesn't turn into a mental illness, so to
So,
speak.
yeah, no, this is a great question. And I think, one of the key things that I should, give a preamble, that everybody's so unique and different.
Yeah.
So what's perfect for me, or what's, important for me, it might not be. So for example, we've got, people that are extroverts and introverts. So people that are extroverts get energy, their soul gets fed from social experiences, where introverts, their soul gets replenished through time alone. And then there's, like, omniverts, who are a little bit in the middle. So we do know that, though, that meaning and connection and belonging is important for everybody. So even if you're an introvert, there's still a sense of belonging, and meaningful friendships that you need to thrive. So and how introverts do that versus extroverts is completely unique to them. So for some people, they're a part of a book club, or they have friends that they keep in touch with, but they might not see a lot of the time.
Yeah.
Where other people who are extroverts might be in, tennis groups, or they go out and play, bingo or games, and catch up with their friends at barbecues, and that's really important for them. But maintaining connections, as a human, is really important. Exercise. We know that exercise is fundamental for people's mental illness. There's so many benefits to the cardiovascular system, to your gut health, the movement. So eating healthy as well comes into that because um, our major players, some of the major neurotransmitters that are huge players in mental illness, like dopamine and serotonin, the majority of those neurotransmitters are actually built by proteins that are in your guts from gut bacteria. So even keeping a really healthy diet, making sure that you're replenishing that with good bacteria regularly. So diet, exercise, and relationships. But another thing that I think is just really important that maybe isn't talked about enough is insight, like being honest with yourself and being honest with how you're coping.
Yeah.
I'm a strong, independent woman, and every once in a while, I have to sort of say, "Oh my God, I'm overwhelmed. There's too much going on in my life right now, or I'm not coping," and ask for help or acknowledge that I'm not coping, and try to find strategies during times of increased stress where you understand what you need. So for me, if I have a lot going on with work and in family life personally, I know that something has to give. So maybe I'll take a mental health day from work, or on that weekend, if I have too much on, I might have to cancel it because I just need to have a weekend at home. Or
Yeah.
if I haven't seen my friends enough, I need to catch up with them because I need to see people, and get that connection back. So being honest with yourself and just checking in and not being afraid to be proud of yourself that you're doing like really good and being like, I'm actually like kicking butt right now. Like life is amazing and I'm really happy. But also having, that contrast of being able to say like, I don't know what's going on, but I'm
I'm
feeling
not
good
okay
as
right
well,
now.
right? Yeah. Yeah.
Yeah.
So it's like honesty, like being honest with yourself and knowing who you are and recognizing.
Yeah,
Yeah, thank
100%.
you.
Like everything you're saying is just, I'm just like, yep, yep, yep.
Yeah.
Like,
I'm just really nodding.
it's like
Yeah.
my
Yeah.
head's
All good.
gonna fall off from nodding.
Yeah.
But I yeah, I think like, as women, as mothers, friends, girlfriends, wives, we are often very our lives are often taken up with looking after other people all of the time and
Yeah.
worrying about other people, and I feel like we do we do lack that insight into how are
Mm.
we doing. Yeah, and Kylie and I have talked a lot on the podcast previously about making that time for yourself and having time to look after yourself and after your health and why it's so important.
Mm.
So that you can be that oxygen mask, you look after yourself first and
Yeah.
then you can look after others. So that's an awesome point. I just wanted to ask Brandi, if you do realize or suspect that you are struggling with your mental health, or a friend is, or what is something that we can do to help them? Or Kylie and I might have a client as well that is struggling. What are some things that we can do to help? And if they don't want to accept help or get help, what can we do in that situation as well?
Well, one thing that I should say, maybe I should have said before, is there we always like certainly when I'm treating somebody in the hospital or in the community, I always try to rule out any reversible cause of something else.
Mm.
So you guys are seeing a lot of women, and you just just women. My God, we got the short end of the straw, right? So
Mm.
like there could be hormonal changes, there could be thyroid stuff happening, there could be iron deficiencies. So if someone's feeling sluggish and has a low mood and it's a real change from their norm, I would always suggest seeing your doctor just for that sort of checkup, or your local nurse practitioner, just to make sure there isn't something else going on. Because sometimes it's iron deficiency or it's a low thyroid. Uh, there could be, a multitude of reasons. And, I'm, oh God, I always forget my age. I think I'm 42. But, there's, I have friends that are, entering menopause or perimenopausal, and how that
Mm.
impacts like brain fog, concentration, mood, weight gain. Um, so I would, I encourage people to just make sure that there's nothing else going on medically first and foremost. And then, there's lots of simple things that we can suggest, like this isn't for everybody, but journaling can
Mm.
sometimes just help people identify day to day what's going on for them. And for some reason, sitting down with a pen and paper is really helpful. And certainly for you guys who are dealing with people regularly, if you ask them, just track your moods for a week until I see you next, or for the next fortnight. And every day, just try to just journal something. And um, even like even if they're journaling their mood, but gratitude, we know that gratitude is so important to well-being. So writing down, three things that you're thankful for. And us at our table every night at dinner, we do our highs and lows, which is really fun with the kids. And we start
Yeah.
with our lows and we end with our highs, but it allows us to be honest about our day. And, even the kids will identify just something that wasn't real great at school or something that
Mm.
happened, but there's always something really positive, and it allows us to, we celebrate them. You should hear our dinner table when somebody like has a really good high, like everybody cheers and woo. So that's
I
a
love
really
that.
good, a really good, that's really simple sort of strategies to recommend for people. And
And that
I
opens
guess
up,
going
obviously,
back to the exercise.
conversation for the stressful or not so great times too amongst your family.
Oh, for sure.
And
And
then you can get it off your
the
chest.
oldest kids in our house are 11, and they're not in those teenage years yet, but so they still talk to us about stuff, which is amazing. And I hope that we can keep that conversation going. But it does, like, if one of the kids hasn't told us that another kid was mean to them at school that day,
Yeah.
or if they got in trouble or something happened, you find out in their low and you're like, oh my
Mm.
gosh. Or what you think shouldn't be a low is a low or something, and it makes you go, oh
Yeah.
wow, that, I didn't know that that was a bad moment for you. If
Mm.
yeah, it's a huge conversation starter, and it allows you to just check in with each other and the people in your home. But yeah, gratitude's great. And obviously, exactly the stuff before, I always just tell people, try to exercise, get outside. There's so much to say for fresh air and
Mhm.
seeing, a blue sky. And um but if you guys are, if ever I see people that, don't want help, or they haven't yet
Mm.
recognized that they need help, um, I try to find people that they feel comfortable talking to, and I'd say, like, oh, look, if you don't, who's your best friend, or who would you go to if you ever had a problem? And if it's, their mom or their dad or a friend, say, why don't you give them a call? And I just try to find different ways to encourage them to have conversations about what's going on, so that they can recognize or get the support that they need from people that they love and trust. And unfortunately, with some mental illnesses, so most mental illnesses have a spectrum. Um, so there's people who might have a less severe part of the condition, or a less severe condition where there's, like depression. So people can have what we call a dysthymic mood, which is basically like a low mood. So I always give the example of like Eeyore. Like Eeyore, who's always just we all
Mm.
have sort of somebody that we know that's just sort of like a Debbie Downer. And they might not meet the criteria for a clinical depression, but they're just always a bit negative. And those people have certain personality characteristics that are sometimes really hard to shift. So the people around them just sort of have to learn to cope and work with that
Mm.
person. And then there's other people who have a more severe mental illness where it's really impacting their life. And even more severe at the really far end of the spectrum is people who have untreated depression that they can then get psychotic symptoms. So that's
Mm.
symptoms like paranoia or disconnection to reality. So either, having stimuli that they shouldn't have, so auditory hallucinations, hearing voices, or seeing things. So at a certain point in time, some mental illnesses need treatment, and we need to
Mm.
say, like, you're not okay. And sometimes that comes down to, calling a professional. And that's usually if they're really at risk. So their safety of themselves or safety of others, where you think, oh gosh. And sometimes that's even their reputation. So we also consider that a risk if people aren't aware. So if somebody's really mentally ill and they're going to lose their job and they don't have that level of insight, like somebody needs to step in, because we don't want them, this mental illnesses are treatable conditions, and we don't want someone to have such a huge impact on their life. So stepping in as early as possible and just really encouraging people to get help if you see that happening is just so important. And I think we've all heard stories in the media of somebody who's done something really bad or scary, or they've ended their own life, or with others. And you'll hear that family knew they were struggling, they knew they were depressed, but they didn't know what to do.
Yeah.
And you can call the doctor for somebody. You can call a mental health team. You can call the police. The police have the capacity to bring people to hospital for a mental health assessment if you're worried about them. And I've never. Well, I was actually involved in a case where something really bad happened, and that family, they were highly educated, and they just thought that it would go away, and it didn't. And there was a really horrible outcome. And so I always think, like, gosh, man, if you would have just got help, or thought, look, let's just take mom to the doctor, even though she doesn't want to go, but let's just go and see if we can get help. So, for the most part, I think it's really important to say, for anyone who's listening, like the vast majority of people with mental illnesses are safe, and they don't hurt themselves or others, because as we know, like between 2 and 3 of 5 of us have a mental illness or have had a mental illness. So the stories that make the news, are the 1 in a million that something bad happened. And I don't want that to give people a bad name, but what we do know is those stories that make the news were preventable. So it's just that's why I just encourage people to get help. Did that answer your question? Sorry.
Yes, and many more. You're fan. I guess, like, is there anything, and I know, like, under Mental Health First Aid Australia, they have certain, they have an acronym that you can, because a lot of time people will say, I don't know what to say to someone if they're, potentially having a mental health episode, or, they might be experiencing some depression. So, Brandi, what are some things that our listeners can say in those situations to people? Like, and is there anything that we shouldn't be saying as well?
Yeah, this is a really good question. So, firstly, I mean, you can say nothing. Like, people just want to know that they're heard and seen, and that they're safe. So there's a real thing about therapeutic silence, where you just can sit with somebody. Like, sometimes when people are in a really bad way, you don't want to say the wrong thing. And if I've said to people before in huge distress, people who are mentally deteriorating in front of me, like, I don't know what to say, but I'm here for you, and I'm just going to sit here with you in silence. I'm just going to hold your hand. So just being there with them until you can figure out what to do is really important, because often, depending on what's happening with people, they can have really racing thoughts. They can be scared themselves. They could be overwhelmed. They might not know. I also often say to people, how can I help? Like, is there anything that I can do to help you right now? There's really I tell people, like, don't ever make promises you can't keep. That's really important. Like, don't promise somebody that you're going to bring them dinner every night for the next 5 days if you're not, because if somebody really starts to depend on that, or they're like, oh my God, thank God I am going to see Kylie or Kylie, and I know that somebody's going to be checking on me, and then you don't do that, that can be a real letdown for someone who's in a bad place. But one thing that you should say is ask them if they're suicidal. you should always ask. If you're worried about it, don't not ask. You have to ask. And it's a horrible question to ask. I know that, but you don't know until you ask. And there's lots of different ways that people can ask that question. Like, have you thought about hurting yourself? Have you thought about ending your life? Um, have you thought about suicide? And I have never had anyone not look relieved when I've asked that question. And they're always honest. Yes, I have. And they'll tell you about it. So that then lets you know how out of a place someone might be in. And some people might say, no, 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 no. I've never, no, and I wouldn't. Honestly, it's just been a bad month or something. Yeah, but I think it's important to ask, and then you know how bad someone might need help. But I really do think that checking in with people and saying, is there anything that I can do to help, or you know, what can I do? How can I help? Being there with people, just letting people know that they matter, I think is really important, that their lives matter. And if somebody's in a bad place mentally in terms of their mood, um, it's always good to remind them of how important they are and who they're important to. So, like my dad not long ago lost his wife due to cancer, and we all check in on him because we know he's lonely. And I will message other people and be like, "Hey, have you talked to Dad lately? If not, do you mind just checking in on him?" And then next time I talk to him, he'll be like, "Oh, guess who called me?" So, making sure that people have a network, knowing what their network knowing what their network is, and accessing that, and making sure. I mean, there's a thing about confidentiality for sure, but if you know a friend of theirs and say, "Hey, do you mind checking in on Kylie? I was just a bit worried about her." That means something to people when they get a call from someone they haven't heard from in a while, and um, it just extends the connection. And again, going back to connection and meaning, meaningful relationships, and we know how toxic or how unhealthy loneliness is. So making
Yeah.
sure that people don't feel lonely. And it's the type of thing too, if you're supporting a friend or, a client or a colleague through a mental illness, it can be exhausting because mental illnesses sometimes take a long time to recover from. And so even as a carer for somebody with a mental illness, you have to take care of yourself. So you have to have boundaries. And that's where that accessing other people and making sure that they have a bit of a network and um, lots of supports is really beneficial.
Yeah, thanks.
That's brilliant.
Again, another long reply. Sorry about that.
Oh, absolutely love
What
it.
It's segues into another
so
question
much
though that we sort of had for you, Brandi. Like if, for example, there's people out there that have people suffering with mental health, depression, anxiety, whatever it might be, and you're one of their carers or close friends or client or whatever it might be, how do you take care of your own personal mental health when feeling probably dumped on a lot, I suppose, by close friends? Not to say in a negative way, but like without taking on all of their heaviness. How do we look after our own selves?
Yeah, so there is a concept in psychiatry and in the helping professions known as vicarious trauma. So that is like where you take on other people's trauma or their hurt and pain so much that it sort of feels like your own. So I like us in health and in our jobs, anyone profession who has access to employee assistance programs like EAP. I always tell people just go, like, to see a psychologist, even when you're feeling fine, but have people that you can go to take care of yourself, people that you can talk to. So not that you're taking that stress from somebody else, but that's how you can also cope with your own stress. But having boundaries, I think. So some people can sort of carry the weight of the world on their shoulders and like like stomp through life, no issues, where other people can get highly impacted by the stories that other people tell them or the stress that people around them are going through. So having real clear boundaries about when it's your time or your off time. So even for, work, we now with our work emails, we get notifications if we're sending emails outside of working hours to be like, are you sure you want to send this? Because and some people
Right,
have in I know. Is that good? Yes. And some people have automatic replies that say, I will only reply to your emails within working hours and give me, up to 7 days to reply because my workload's unmanageable. So having really clear boundaries around expectations, and I guess um, that's really important. And it's really hard, I think, when you've got someone who's going through a really hard time and they're um, like perseverating on it. And it's sort of, so it's really important because those people are struggling. They're having a hard time. You're not perseverating on an issue that's easy. It's something that's hard for them and they can't work it out themselves. So they're having to go over it. So, a good suggestion is to let them talk for, an identified period of time. So you might say, okay, Kylie, we're catching up for coffee. And I definitely want to hear about how much you're struggling with, your son being off at college. Let's talk about that first, okay? And let's talk about it for 5 or 10 minutes, whatever. And then I want to talk about that vacation you went on. So making sure that you're still giving time, that they feel listened to, but you're trying to move it on to something else more positive as well. But I think too, just doing all that sort of stuff for your mental health. So making sure you're exercising, that you're eating right, and you're doing things that feed your cup and your soul. So if you're that introvert that likes to read, making sure that you've got identified time in your day for you to read that book, if that's what makes you feel, grounded, and finding those things out. Like as an adult, in my 40s, there's a lot of people who don't know what grounds them or what feeds their soul. So again, that's where something like journaling or that, gratitude can come in handy, where people start to recognize that, wait a minute, I felt amazing after I was at the beach that day, or I felt awesome after that walk, or, when I spent time with Kylie and we had that coffee, like I felt really good after that. So helping people to identify what makes them feel good and doing more of that. More good stuff.
Yeah, good tips.
Yes. Amen, sister. That is.
And I should say, and saying no, like especially, us women and mothers and partners who do it all for everybody. I was always, a yes person, and it's really important to identify when something is causing you anxiety, or you've got too much on, or you've said yes to too many things. Like you have to take care of yourself first. Like even as a mom, some people, really do everything for their kids, and I think I do a lot for my kids. But every once in a while, it's no, because I have to take care of myself, and I know that if I'm not taking care of myself, like who do the kids have? They need me. So I see taking care of myself as taking care of them, because if I don't take care of myself, and I'm in bed all day, what kind of a mom am I? So yeah, making sure that people look at their own mental health and well-being like that.
Yeah, and I think too, it's important as a mum that we have to role model that to our children as well, that looking after yourself is important. Mum needs time, and that's okay for mum to have that time to go for a walk or go for coffee with a friend, or or whatever it might be. So yeah, we need to be role modeling that
no can be said.
Yes,
and accept no sometimes. You're not always going to get told yes.
Very important. Yes, good lesson for kids.
Yeah. Spot on. All right. We maybe just a couple more questions, if that's all right, Brandi.
Absolutely.
I wanted to just quickly ask about medications. So, if a client or a listener is on, are there any particular medications that will affect the other aspects of their health, in terms of putting on weight or losing weight, or those type of things? That's the first part of my question. And then the second part of my question is, and it's in a little bit of a different direction, but what are you seeing coming through in terms of research, and in terms of what's happening with people now in terms of mental health, in relation to technology and the effects of that? So sorry, a two-pronged question there, but
that's okay.
Yeah, just Otherwise, I'll forget about the second question.
That's okay. So in terms of medication, I guess just really broadly, I should say that we should really be moving in psychiatry and in medicine to a concept called personalized medicine. So I find it's really important that your treater or whoever is prescribing medication for anyone, that they're actually looking at the specific symptoms of what each person has. So in Australia, we have recommended sort of first line treatments that are, Australian guidelines, like the therapeutic guidelines is the place that we go to frequently when we're looking at diagnoses and treatment and management from a pharmacological point of view. But it's not always what's best for everybody. Not only do people have allergies and intolerances to medications or side effects that are unwanted, but you really, the way I experience anxiety and the way somebody else does is probably completely different from each other. And that's the same with something like depression. So depression, people who suffer from depression can have like a whole plethora of symptoms. And what is the most sort of debilitating symptoms for you might be completely different to me. So important that your prescriber takes that on board. So but medications are really complex, and they absolutely do come with side effects, and they can impact people in lots of different ways. So antidepressants, for example, can sometimes cause people to gain a bit of weight. It can impact libido, which can be then cause issues in relationships, or like a part of your life that you used to get joy from, now that's been taken away from you. Antipsychotic medications can also cause weight gain. They can make people sometimes feel sluggish. Medications for anxiety, which can be things like benzodiazepines, can be sort of sedating as well, but we also use antidepressants for that. But I guess the key takeaway is that treating your mental illness will have a huge benefit in itself. So if you're struggling with weight gain and lack of energy because of your mental illness, the medication should help get you that energy, that get up and go to start exercising more, and then you'll be eating healthier, and then it will, you'll be sleeping better and concentrating more. So it really should, the risks and the benefits should always be considered when you're prescribing a medication and when someone's taking it. But I guess just being open to managing side effects and speaking to your medical prescriber about those side effects, and being open and honest with them about that. So what we don't want is to put someone on a medication that we know might take a few weeks to become therapeutic, and then find out that they didn't keep taking it because they had a side effect, and then they remain untreated even though we're worried about them. So again, just being honest and aware, and coming back and saying, look, this is what's happening to me. Like I've gained all this weight, and now I have a huge issue with my body image. So they're, medical practitioners, psychiatrists, psychologists, who support you emotionally, and like nurse practitioners like myself, I don't want somebody to have an issue around their body image. So we're going to cease that medication and try something new. And everybody has sort of reacts differently to medications, and that's due to a multitude of things, including genomics. So I guess people just be aware of that, and talk to whoever's prescribed that medication. In terms of what we're seeing about technology um, and the impact of that on mental illness is really huge. We know that young kids are now using social media at a much younger age than we were in our generation, who I didn't have my first mobile phone till I was in my early 20s. So I look at my kids who get home from school, and if they're on their iPad or their phone, they can have access with their friends, minutes after they've just left them at school. if you guys were like me growing up in Canada, like people had to call my house, my landline, and like go through my mom first. They had to say, "Hi, can I speak to Brandi?" And so parents knew who was calling. They knew how long you were on the phone for. They knew who you were engaging with. If you had a bad time at school that day, you could not have to deal with it again until the very next day. Where now that can continue onto social media, people posting stuff, engagements with each other. So I don't know that there's a lot we can do about it. There's also positive aspects to social media that I think is important when it comes to connectedness. My grandparents, before they passed away, were all on Facebook and loved seeing my photos from Australia. And it can really bring people together. But I suppose it's about finding that balance. And we see, the stats that I spoke about at the beginning of our conversation sort of speak for themselves, where we're seeing more younger people with mood disturbances and anxiety than we ever have, ever. So I think, one suggestion to your listeners, if they're parents, is making sure that you have a really good relationship with your children, that they can be honest with you about what's going on for them, and that they feel safe coming to you, and that you demonstrate to them that you want to help them and protect them. So how do you make sure that you're doing what you can for them? Because some of them are anxious to not be in contact, because if I miss out on that, well, all my friends are going to make plans to catch up, and now I missed out on it because I wasn't on my phone. So it's really about finding that balance. And when my oldest daughter started messaging, I had to even teach her that, like, whatever you say to your friend, because she had a friend at one stage who screenshotted a message from another friend to show her. And I was like, well, that's a good example. Keep in mind that someone could do that to you too. So making sure that they know just sort of, I guess, the risks of it all. And if something bad does happen, that we're there, because it can feel like the world's going to end when they have issues. And certainly on the big platforms like social media, it can feel really overwhelming. So I think that parents just need to be really aware of it. And like my kids, my oldest daughter has an Instagram account, but it's private. I manage who comes and goes on the account. Like, I don't manage it, but I check it regularly. She doesn't accept anybody unless that's approved by me. But for example, she's not on Snapchat because I'm not on Snapchat. I don't know Snapchat. So until I familiarize myself with an app or a platform, she's not going on it. So I think important for parents to be mindful to, like, stay on that train with them, so that you understand it and you understand, the risks of that platform, so you can protect them as well. So I think that those are just some suggestions, because it's, there, like I said, there's real benefits to social media. There's real benefits to technology, like us here. We're all in different places having this wonderful conversation, and we can do that. And I still feel connected to you guys doing this, and like we're having a chat. But there's limitations to it, and the impact that it's having, I think, is evident in the numbers that we're seeing. So the other thing that I try to do, and I know other parents probably do it even better than me, but I always try to have tablet-free times, try to exercise with my kids as well. You were talking about role modeling before. My kids see me exercise every day. I go for bike rides with them. I play soccer with them. I'm not sending them out to do that alone. I'm doing it with them. So they see that even when you're 42 or 3 or whatever I am, we still exercise. It's not just something that you do once in a while. It's not just a fad. It's not just to lose weight. I also don't say that to my kids. I talk, exercise is just a thing that we do all the time, because our mental health needs it, our body needs it. And back to the weight thing, I talk about being strong and being healthy. I talk about being mentally strong. I do talk about my stress. I talk about stress openly with my children, and say that exercise helps me with that. Like, going, on my elliptical or whatever it is, or kicking the ball or playing tennis. I use those examples of how I manage my stress. So they see a really positive coping strategy. But engaging with your kids and doing that, like I did mother-daughter tennis lessons with my two daughters for the past 3 years, and it is like my favorite part of the week. And it's so fun to do that with them and engage in something like that as a family. So it's just my 2 cents on that. But exercise, tablet-free time, be the example, because I did also at one stage talking to my fiance about my kids being on their iPads, and like I think I had my phone and was like, "Can you believe how much they're on there?" Like, "Oh my God." And he's like, "Look at you," or like, "Don't have your iPad before bed." And I'm like, "Yeah, get off your iPad," as I'm lying in bed on my phone. So I think that role modeling, and I think too, as parents, and certainly women, role modeling healthy friendships and healthy behaviors. So if your friends, if your children hear you gossip with your friends about other friends, they hear you, talk rude about somebody in a mean on purpose sort of way, they are sponges. They're taking that. So then if you hear about them being at school being rude or making fun of somebody, and you're like, "Oh my gosh," it's really important to be mindful about what's happening at home and what type of friendships you're role modeling for them, for that sort of meaningful connections as well.
Yeah, and same goes for relationships too. I imagine, Brandi.
Totally. Absolutely. Like we were talking about it before about, taking time for yourself, like go on dates. Like be, have a healthy relationship with your partner that they can see, and be with somebody, especially for girls, I think. And I know that, but I think for girls, be with a man who treats a woman well, so that they, are that equal platform where they see, a mutual respectful relationship where there isn't DV or emotional abuse, yelling or violence in the way you are role modeling the type of relationship that they will and behavior that they will accept or not accept. And
I
the
guess
best
with raising boys, teach them to be those men and role model those sorts of men.
Yep, and that's where you want to have a partner that they see as a boy, as a son, you want to see your mom with a man that treats her well. And then you think like, again, it's so important.
Yeah, like I think like the partner, you have to be supportive of one another, like supportive of, if one wants to go for a walk or go to the gym or, do whatever feeds their soul, then the partner needs to be supportive of that and understanding and not resistive to that, because that can make things very difficult for people, can't it, Brandi and Kylie?
Oh. And certainly the time, because like especially if you have young kids. So if you guys have clients or know other women that have young families, and they, what feeds their soul is running, and they can't get the toddlers to run with them. Like they're not fast runners. So they have to do that. So you're relying on your partner to step up and help out. So I think that it's really important to highlight the benefit of that to the family and the relationship. So again, going back to like a happy mom and a healthy mom is a happy, healthy family, and a happy, healthy partner creates, the positive benefit in that relationship. So making sure that you're framing it in that way for your partner, so that they can say, well, and even like some partners, maybe they want to go out on more dates, or they want more, even more intimacy. And if you're not feeling good about your body and the way that you feel about yourself, that's really hard. So if you could tell your partner, if you let me run 3 times a week and I start to feel better about myself, like, things might get a little bit, fun in the bedroom. And like, I don't know any male partner who wouldn't be like, okay, go, I've got the kids. So, framing it so that I think people understand, the benefit of it. And I was actually listening to a podcast just the other day about the foundation of home and how, if our home is happy and healthy, like the rest of life becomes okay and manageable. So
Easier.
that
Yeah.
comes from, yeah, it's your family being, and it's everybody. You know what? You know the saying, like if kids are happy, you're happy, but it's
Yeah.
also your home. So your number one like priority should be, are we all happy? Are we safe? Are we okay? And if your answer to that is, I'm not right now, well, what's going to get you there? Well, exercising more, working on my mental health. That's going to help everybody. The ripple effect of mental illness and of mental health is huge. And so if I think if people understood that more, more people would be proactively trying to manage their mental health so that they don't become mentally ill.
Yeah. Well, Brandi, I think that is a good place to wrap it up. Kylie, unless Kylie, Jade, did you have any further questions for Brandi at all?
No, I think, that perfect place to wrap it up. Ended it on a really good message, I think, there.
Thank you.
Yeah. Unless, Brandi, did you have anything else you wanted to say at all?
Not really. Like, I think just talking about what's going on, being open, reaching out to people. Like, there should be no stigma about mental illness anymore. It's sad if there still is, and there's, we know that this is impacting so many people. So being that place of a judgment-free friend who's just there to talk, judgment-free mom, judgment-free friend, judgment-free partner, having that safe space for people, I think is hugely important, and get help, because help is there. And as I said before, mental illness, they're treatable conditions. So don't let that impact your life. Get help, and don't suffer. So no, that's it. But thanks for having me. I love talking about this stuff, and I hope that it helps anybody to get help and live their best life.
Thank you so much. We cannot thank you enough for coming on today.
Yeah.
Everything that you have talked about is just absolute gold, and we are so grateful for you coming on the podcast today. So thank you. If you liked this podcast, if you like the podcast, please leave us a 5-star review and some comments, and we will leave it there. Otherwise, we will see you next week. Thank you, Brandi. Thank you, Kylie, Jade. We'll see you
Brandi.
next time.
Thank you, Kylie Ham. See you next week.
Thanks, everybody.
Bye-bye.